After a Washington Marine got back from his deployment in Iraq, he was diagnosed with cancer. Doctors said it was the direct result of harmful chemicals he was exposed to while deployed. Now, chemo has caused his lungs to fail, and his wife says the VA isn't helping him get a life-saving transplant here locally. King 5's Maddie White reports.
Marine veteran Andrew Stevens, his wife, and 3 kids.
He said, "Did you do well? Did you do good?"
Spend a lot of time visiting him at the ICU at Swedish Hospital. He's using an ECMO life support machine to breathe. But tomorrow, he gets life flighted to Illinois.
It's been a really challenging.
To be evaluated for the only thing that at this point can save his life, a new set of lungs. The VA covers his health care. The only transplant center they partner with in Washington is at UW-Medicine. But his wife Stephanie says they rejected his transplant eligibility, pointing to outdated medical guidance that used to recommend 5 years of remission before a transplant for fear that cancer could come back.
It's a well-intended policy.
Yes, Stevens has only been in remission from cancer since February, but this is what a renowned transplant doctor in another state told his team after reviewing his case. Medical guidance on this was also updated in 2021.
So that they aren't just giving a hard no to people.
The guidance now says a transplant may be an option where the risk of recurrence is deemed very low. It's why Northwestern is willing to evaluate him, but then why isn't UW-Medicine?
The VA isn't pushing to change the policies around this partnership. It hurts even more.
I asked the VA of Puget Sound to go on camera to explain why, and they instead responded with a statement reading in part, quote, "Veterans with the potential need for a lung transplant are among the highest risk patients we care for," and that their decision, quote, "requires the integration of several considerations." Now Stevens' wife and 3 young sons
Brooklyn started school 2 weeks ago.
are having to uproot their lives to move across the country.
Knowing that there is one of the top lung transplant centers in the United States just down the street from our home that wouldn't require even more disruption than what we've already faced this year. When you are a service member, you do not leave anyone behind. You do not leave anyone behind.
Maddie White.
And he does not want to leave his family behind.
King 5 News.
A spokesperson for UW-Medicine declined an interview, instead sending us a statement reading in part, quote, "Each lung transplant center determines their eligibility criteria based on updated medical guidance, studies, and standards."